welcome again to my YouTube channel on all topics related to Ayurveda and yoga. And today I want to continue the topic on yoga therapy for people who were suffering heart diseases or post-COVID, long COVID or other problems chest related. So whenever we want to go back to our yoga practice, or we even want to start a proper yoga practice in order to feel better, to get some more strength and vigor, we have to be super careful not to overstrain, not to stretch too much, not to put load on the chest, instead of just focusing on alignment, proper slow breathing and deeper relaxation of the muscles. We know that a lot of oxygen is used when we are tense. So it's very important for our recovery from our long-term diseases, or to just accompany and sideline chronic diseases, that we are getting more cautious about our oxygenation. One part of recovery is to reduce oxygenation, which means we have to reduce hyper breathing. A lot of people these days follow yoga channels, and it's always the word saying take a deep inhale or breathe deep, and then what people are doing is that actually not breathing deeper, they are breathing more shallow into the tip of the ribs, which is not the area where oxygenation of the blood is happening. We're having much more exchange of oxygen and carbon dioxide in our soft rib area. So when we say inhale deep, we actually mean in yoga that you are more inhaling on the back of the body and deeper into the chest, opposed to having a sharp inhale which is just coming here. So oxygenation has two sides. One is we need oxygenation of the blood, but for chronic disease we have to reduce the load of oxygen in the body, and we're trying to increase the sensitivity and desensitize the sensitivity of carbon dioxide. So that means that our breathing is getting slower. The slower we breathe, the higher our carbon dioxide level is building up, and then we're building a tolerance to carbon dioxide, which means we are reducing actually the amount of breath that we're taking in order to create something we call air hunger, which then forces the body to get the oxygen from the blood into the cell where we need it for recovery. If it stays in the bloodstream, there's not much point. So hyper breathing, hyper oxygenation through hyper breathing will not help any recovery, but will put more stress on your lungs, more stress on your system, more stress on your heart. So today we're there for looking into gentle breathing, opening the chest widely and softly, and trying to start our road to recovery here today. So in order to put less strain on the body in yoga, we start with sitting position on the floor. So I want to start with a normal pose like Dandasana, which helps me to elongate the chest and the spine. So when we look sideways, we are putting our heels firmly into the floor, we are spreading the thigh, we are lifting the chest, and so we have an opening on the back of the chest in order to breathe deeply here. We naturally feel that our stomach is moving in, so our organs are actually supporting the spine, which is different to this position, where we are actually putting a lot of stress on the heart, on the spine, and our organs are dropping on the floor. If you feel that this is already quite a hard pose for you to do, because you're strongly lifting your side chest through your abdominal muscles, you are lengthening your paraspinal muscles, we are now looking into some variations for you. Okay, here I have a gentle support on my back of the spine, just around the shoulder blades. So sitting now is very comfortable, yet I still have to work. I still have to lift my side chest, I still have to lift my back chest, and I gently hug my ribs. In order to use more of this posture now, I'm going into a stretch and I'm lifting my arms up, and now you can see how much my back chest is actually lifting. And if I feel that this is putting too much strain, again I can fold my arms, still lift. I'm keeping my throat open, which is Udana Vayu, and I'm stretching my neck. And I'm trying to reduce the number of breaths. So now I'm changing my arms. And can still elongate my chest a little bit more. And if I feel comfortable now, I can gently press my thighs and move into Paschimottanasana. Again, I'm avoiding a back arch. I'm strongly bending forward just from the hip joint. And then you stay here, you don't fold forward more. You can bring your fingertips down and lift the chest a bit up, but again, avoid arching. Lift the chest, lift the collarbone. Be strong on the thighs, don't be heavy on the chest. We had this last time when we said just try to let the heart move back to the spine. Don't bring the heart forward because this increases your heartbeat rate and makes you get out of breath. So allow the heart to literally melt into your chest cavity towards the spine and feel the softness of your chest. If you don't feel comfortable with this, you can just move you around. Use the chair, put a blanket on the chair. Again, focus on the leg stability and then gently bend forward. You're resting your head on your nose bridge. So whenever you feel you are done with the pose, you can give it a little bit more stretch forward. You can press your feet a bit longer, a bit harder, but avoid completely any pressure on the chest. Okay? So we're now coming to another variation, which might be more suitable for people who don't feel so comfortable being on the floor, because one thing is being on the floor, the other thing is coming back up. So we can use a chair. This is a particular yoga chair which you don't need. You can use any chair, and you're sitting upright. Again, you make sure that you're not collapsing your chest. You're definitely not arching your back, and you're also not hunching your back. What we are aiming for in yoga, in particular yoga therapy, is we are trying to maintain the lengthening of the lower spine, and we're having a slight curvature on the upper spine. So when we look at the natural curvature of the spine, we're actually kind of reversing it. So I'm now keeping my feet strongly pressed into the floor. There's always the particular part here of the back of the moon of the heel. I'm squeezing my feet into the floor, so I'm engaging strongly my calf muscles, which you can see here. There's a little ditch. That means I'm fully activating my legs now. Then I very gently lift my anterior spinal iliaca of my pelvis. So the area of my groins are getting soft and lifted and supporting my sitting position. From here, again, I can bring my arms up and I can lift my back chest as much as I want. And I can stay here for, let's say, 5 to 10 reps. And if I feel confident, I can lift my chin. I'm looking with my eyes backwards. I'm extending my middle finger to the ceiling. I'm lifting my back chest. I can cross my arms, give it a little bit more lift on the side chest. And then I come back to relaxing pose. So I gradually can build up strength. I can start with a normal sitting position, normal breathing. If I feel more confident, I slowly extend my arms over time. The forward bend is also far more comfortable on the chair, so I have one option that from the hip joint, I'm very gently moving forward, extending my side chest, extending the back of the spine, lifting the chest. The heart is gently dropping towards the back and the navel, and if I want to, I can extend my arms again. Again, you can see the engagement of the calf muscles and the engagement of the arms. In particular here, the armpit chest is extending the most, which means I'm opening my ribs sideways and I'm breathing into the back of my ribs. I can give myself a little bit more of a crunch and lean more forward. If I feel I'm still not out of breath, wonderful, I can lift one leg up. If I feel comfortable, I can lift both legs up. Gently fold, bring the legs forward, lift your chest up, and again you can lean and fold forward. Gently come back to sitting position and relax. So for all the breathing that we are doing now, we have now prepared our chest. And we are coming for the first breathing exercise. We all know probably the Nadi Shodhana exercise where we inhale on the one side, exhale to the other side, inhale to the right side, exhale to the left side, and so on. And normally it is practiced with closing the nostrils alternately. What we're doing now is that we just use our imagination and we very gently direct the breathing starting from the left nostril in order to calm our nervous system. So I'm now only directing with my imagination the breathing through the left nostril. I gently stop the inhalation and I exhale to the right nostril. Inhale right. Exhale left. Inhale left. Exhale right. Inhale right. Exhale left. And continue for 15 more breaths. Each time you are going into the visualization of changing your active nostril, be aware also of the changes in your chest. When you're inhaling, normally your chest gets wider, and when you're exhaling, the chest gets a bit smaller. Gently try to balance so that you don't have such a big shift in your body. Each time you're doing this breathing, try to breathe slower and then start focusing on the moment when the breath is flipping. So there's the moment where the inhalation starts, is building up, and then there is no space you feel. And in order to overcome this feeling of tightness in the chest, you're actually relaxing a little bit more. And you're trying to continue this fine and subtle breath a little bit higher, a little bit higher, a little bit higher. Try to relax the muscles to give space, because our breathing muscles from the normal life are actually constricting the chest. So give it a bit more space. So you inhale, I make a sound now. And now comes the point where normally my patients say, oh, that's enough. I can't take more in. And then we go beyond this point of comfort and letting go and feeling actually something that is better than the initial comfort, something that's a deeper relaxation. So I'm giving space for my breathing muscles, I'm giving space for my ribs. So I inhale more. I'm relaxing my diaphragm more. I'm using the back of my lungs more. And normally I can inhale further and further and further. When I then come to the point where I said, now there's no chance, I very gently and gradually focus on the moment before the breath is changing from the full inhalation to the start of the exhalation. Just focus on this moment. And extend this moment bit by bit before you then gently and slowly and gradually go into the exhalation. This is very different to inhale, hold, exhale. We want the subtleness. We don't want the harsh changes within our breathing because we want to open up our cavity of the chest. We want to feel the wind moving inside our chest. We want the prana moving inside our lung and heart. We want to spread the prana through the channels. We don't want to hold. We don't want to put force. So when you start and gradually exhale and you come to the point where you feel, okay, now I exhale fully, then you give it a little bit more of a challenge because there's still something which we call the residual volume in your lungs that you can still squeeze out in order to really get some fresh prana, some fresh air into your lungs. After you did your breathing, I would suggest to do something which we do often as an integrative meditation, which is coming from Swami Rama of the Himalaya Institute in Rishikesh, which I want to share with you now as a little teaser for the next series of meditation. So normally my patients struggle a lot with seated position for a longer time, particularly when you're on your recovery route or when you have been exhausted and then you have to sit and suddenly your mind is going all over the place. So we're trying to do the Swami Rama method, and originally it's about an hour or 45 minutes of each of the 3 positions, but I found out with my patients it's quite good to start maybe with 3 minutes each position, extend to 5, then 10, then maybe 15. What I feel is necessary is routine and confidence and not putting more strain on somebody who's already strained from normal life. So for the Swami Rama method, we start with lying in supine position and we are extending our groins on the floor. Now comes the part that I really cherish because you don't have a rule where to put your hands. So you can start with putting your forehead down, putting your forehead comfortably on your hands, lying down. Whatever feels comfortable, you choose as your position. You're lying here now and you can stop the video for 3 to 5 minutes. You're lying down in one position that really suits you. Just make sure that your groins are happily extended on the floor. After the 3 to 5, 10 or whatever minutes you come back up and you're now moving into something we would consider as a Shavasana. Again, there is no rule, there is not any force to say don't move, don't think anything. In fact, just that there's the absence of any instruction, it gives the people far more relaxation and confidence to continue to the next position. So you're lying down in a normal back position. Again, when you feel moving, when you feel something is itching, don't force to suppress, follow it, let it go, continue lying down. You can do a little body scan to find out if your shoulders are tense, if your abdominal organs are popping out, if you're arching your back. And you gently let go, but you don't even have to. You just let go of anything that feels uncomfortable. Again, you can pause the video here for 3 to 5 to 10 minutes, whatever suits you. And then we're coming to the last position, which is the sitting position. Again, we're choosing any position that feels comfortable. And we're sitting here another 3 to 5 to 10 minutes. And then gently come back and enjoy your day. And if you haven't subscribed or liked, it's now time to do that. And thank you very much for watching. And be free to ask questions. Put this in the DM of this channel. You can also WhatsApp me, whatever interests you in all topics of yoga and Ayurveda. I'm happy to hear from you so I can make this channel grow according to your personal needs. And yeah, so I hope I see you again and have a great day.